Red blood cells. First, a bit introduction.
Blood is the largest organ in our body. 10 pints of life force coursing through thousands of miles of arteries, veins, and capillaries. Those blood vessels carry blood to every other organ, keeping them functioning and thriving.
Definition. Are the most common type of blood cells and the vertebrate organism's principal means of delivering oxygen to the body tissues via the blood flow through the circulatory system. They take up oxygen in the lungs or gills and release it into tissues while squeezing through the body's capillaries.
Blood has been called the river of life, transporting various substances that must be carried to one part of the body or another. Red blood cells are an important element of blood. Their job is to transport oxygen to the body's tissues in exchange for carbon dioxide, which is carried to and eliminated by the lungs.
Applications in medicine. The primary function of red blood cells is to carry oxygen from the lungs to the tissues around your body. As a secondary function, they are also a key player in getting waste carbon dioxide from your tissues to your lungs, where it can be breathed out. When red blood cells stop functioning properly, you can rest assured that many things are going to go wrong in your body. Pros and cons. Pros. Blood transfusion can save a patient's life and limit the complications of severe blood loss. A lot of bleeding can lead to a seriously low hemoglobin level and cause damage to body organs due to lack of oxygen. If bleeding continues, the body supplies of platelets and plasma are also decreased. Then, blood cannot clot and bleeding will not stop. Blood transfusion benefits patients by treating or preventing this situation.
Transfusions are so ingrained in clinical practice that in many clinical situations, a significant number are given to alleviate physicians' discomfort rather than care for the patient's needs.
Cons. The risk of transfusion-transmitted disease for each unit of blood is HIV about 1 in 4 million, hepatitis C about 1 in 3 million, hepatitis B about 1 in 1.2 million, West Nile virus about 1 in 1 million. Hemolytic reactions. The patient's own blood destroys the confused blood. This is due to a human error. Careful patient identification steps are followed to make sure the correct blood is given. Bacterial infection, highest with platelet transfusions. Side effects could include itching, skin rash, fever, or feeling cold. More serious side effects such as trouble breathing are very rare. Blood transfusions are very carefully matched to the patient's blood type, but transfused blood is not identical to your blood. Transfused blood can also have effects in your immune system.
One drop of blood carries millions of these cells, the red blood cells. They have this distinctive shape, which gives them a large surface area to absorb oxygen, and no nucleus, so they have maximum room for the substance hemoglobin. Hemoglobin is a bright red pigment and gives blood its colour. It's a globular protein with the metal iron at its centre. It's the presence of the iron that gives hemoglobin its oxygen binding and releasing properties. The hemoglobin is transported along the blood vessels within the red blood cells.
So how does hemoglobin work? How does it know when to pick up oxygen and when to let it go?
Well, in areas where oxygen concentrations are high, such as in the lungs, oxygen passes into the cells and binds loosely with hemoglobin to form oxyhemoglobin. In this state, it travels through the body until it reaches an area where oxygen concentrations are low, such as close to working cells. In the working tissues, the red blood cells let go of the oxygen and revert back to hemoglobin, ready to be used again.
Disease. Platelet disorders, excessive clotting and bleeding problems, which affect how your blood clots. Anemia, which happens when your blood doesn't carry enough oxygen to the rest of your body. Cancers of blood, such as leukemia and myeloma. Eosinophilic disorders, which are problems with one type of white blood cells.
Our red blood cells make up 40% of our blood's volume. They're made continuously in the bone marrow, looking like flattened donuts without the holes. Red blood cells contain hemoglobin, a bright red protein which gives blood its color. When we breathe, as our blood passes through our lungs, oxygen molecules attach to the hemoglobin. Then the red blood cells and hemoglobin transport the oxygen throughout the body and release it to all our cells and tissues. When the hemoglobin molecules are emptied, they attract carbon dioxide and other waste gases, which they take back to the lungs to be exhaled. Anemia occurs when there are too few red blood cells or not enough hemoglobin. Exhaustion is the common sign of anemia.